Her face was disfigured. She couldn't breathe through her nose. Doctors were stunned at the solution her body would need to survive. Imagine waking up one day and a part of your face is simply gone. This was the reality for one woman who suffered a severe injury, leaving her with a significant nasal defect. The damage was so extensive that she couldn't breathe properly, and her confidence was shattered. In the sterile environment of the clinic, doctors huddled, their faces grim. Traditional reconstruction methods were off the table. The tissue damage was too severe. The blood supply compromised. They needed a radical solution, a technique that sounds like science fiction, but is a well-established marvel of modern medicine. They had to rebuild her nose from scratch, using a piece of her own forehead. This procedure is called a forehead flap reconstruction. It's one of the oldest and most reliable methods for rebuilding a nose. Surgeons begin by meticulously mapping out a section of skin on the forehead, complete with its own artery and vein. This flap of living tissue is designed to become the new nose. Precision is absolutely critical. The flap must be planned with mathematical accuracy to ensure it. Not only looks like a nose, but also has a robust blood supply to keep it alive. This isn't just about moving skin. It's about transplanting an entire living system from one part of the face to another. The operating room is a place of intense focus. The air is thick with anticipation. The slightest miscalculation could be disastrous. A mistake here could lead to the death of the tissue flap, a severe infection, or complete failure of the reconstruction, leaving the patient worse off than before. The team knows the stakes are incredibly high for hours. They work in a silent ballet of coordinated movements, each surgeon, nurse, an anesthesiologist playing a crucial role. The tension is a constant, unseen presence in the room as they embark on this delicate and complex journey, with the flap designed and lifted from the underlying bone. The most intricate part of the surgery begins. The surgeons carefully rotate the flap of skin downwards, creating a tunnel under the remaining skin of the brow. It's then draped over the newly constructed nasal framework, which might be built from cartilage taken from the patient's rib or ear, using microsurgical techniques. The flap is sutured into its new home. Tiny clips are used to ensure the delicate blood vessels aren't compressed, maintaining the vital flow of blood that will keep the new nose alive. Every stitch is a step towards a new beginning, a testament to surgical artistry. During one such procedure, a nurse new to the team almost fainted at the sight. The visual of a nose-shaped flap of skin, still attached to the forehead by a pedicle, hanging over the patient's face was jarring. It's a surreal image, a temporary state that looks more like a disfigurement than a cure. But the lead surgeon, calm under pressure, simply reminded everyone to focus. They held their breath, watching the monitors, checking the color and temperature of the flap, praying that the tissue would take after the long surgery. The patient begins the slow process of healing for several weeks. She lives with this strange new appendage on her face. The forehead flap remains attached to its original blood supply while it grows new connections in its new location. It's a waiting game, a test of patience and resilience. But then, day by day, a miracle unfolds. The swelling goes down, the tissue integrates. And what was once a flap of forehead skin begins to look and function like a nose. Finally, the pedicle is severed in a second, smaller surgery, and the new nose is fully sculpted. The results can be life-changing for this woman. It meant she could breathe freely again for the first time in years. She could look in the mirror and see her whole face looking back. A forehead flap reconstruction is a powerful example of how medicine can transform lives, turning anatomy into art and giving people back what they thought was lost forever. Thanks for watching. If you found this incredible, don't forget to like and subscribe for more amazing medical stories.